Hi, everyone. Today we have an amazing co-author spotlight of the book, How Healers Heal. We have the privilege of talking to Dr. Elisa Pathak. I've known Dr. Elisa for a few years now, and I'm a huge fan. And I'm so excited that she shared her story with us in the book. And she's going to chat with us a little bit about her practice and how she uses all the principles of lifestyle medicine in her practice. Hi, Dr. Pathak. How are you?
Great. Hi, Dr. Pradhan, and thank you for being here. And I am also a huge fan of yours. And it's been an honor to be a part of this book and this project. And I'm more than happy to share my experience. So I am originally from New York City and now live in Pennsylvania. I always wanted to do primary care and couldn't decide between internal medicine or peds because I loved both. So I ended up doing a med peds residency and really wanted to try to, work with families and do preventative care. That was always my goal, keeping, families together. I mean, healthy mentally and physically. And so I eventually started my own practice and in Pennsylvania. So I do have a practice there for about 15 years now, my own practice, which has been going great. But as we all know, the practice of primary care and internal medicine and pediatrics, it's not really as preventative as I really would have liked. And then when I came across the field of lifestyle medicine, it was exactly what I wanted, what my goal was, and trying to really prevent, reverse, and treat chronic illnesses and not just throw another pill for every complaint. So
You answered my next question. That's awesome. I mean, your chapter is so powerful. I don't want you to give it away, but some of the things that I really loved were how you highlighted that you were vegetarian, but you still benefited from all the other lifestyle changes, especially social connection and the importance of it. I think I pulled out one of your quotes and put it on the back of the book. Can you talk a little bit more about all the most important lifestyle pillar? Of course, all of them are important, but without giving away your chapter, we want people to read your amazing chapter.
absolutely. I mean, it was so eye-opening to learn, the medicine and the science behind lifestyle medicine. And some of it was intuitive exercise. We all know that we need to exercise and sleep. For me, those were pretty intuitive, dietary and nutrition changes or nutrition advice changes greatly amongst different organizations, and that gets super confusing. Um, Although I was vegetarian, I still could have been eating better. Definitely didn't eat enough fruits and vegetables. There was a lot of carb and a lot of and I did eat processed foods and things like that. So I definitely have cleaned up my diets and made it even better than what it was. But the good thing was I was kind of avoiding a lot of the high inflammatory foods, but I wasn't probably eating as much nutrient dense as I would have liked to. But I think, and we all know the harm of substances and substance abuse. But I think for me, the biggest surprise was the evidence behind the importance of social connections as it pertains to your physical health, so did realize that was important for happiness and for mental health, but even for your physical health, that was really eye-opening for me, and it really made me change a lot of things, either getting rid of toxic relationships or really putting more effort into the relationships that were important to me.
I wanted to grab a copy of the book and read your quote. This one really stood out for me, and I obviously pulled it out and put it on the back cover of the book because I loved it. All along, I thought of catch-up time as a luxury and not a necessity. That's amazing. Okay, well, let's talk a little bit about your practice and how do you incorporate lifestyle medicine into your practice, and tell us a little bit more about the course and how patients can work with you in your practice.
Absolutely. So when I learned, all the pillars of lifestyle medicine, I started incorporating them for myself and telling fans and friends and family. And it took me a while to actually start implementing it into my practice. So I didn't know I see all ages, but I see more of the complex patients in the practice, which ends up being the older patients that are pretty set in their ways. And I wasn't sure how open they would be to any, making real changes in their lifestyle. So I kind of slowly started giving some pointers and some advice while, and really started more motivational interviewing and really finding out like certain little things they can start changing, what they might be interested in improving. And I was shocked at how open everyone was. And that's what people wanted. Like they wanted to make changes. They wanted to get off medication. They didn't want another medication. They wanted to know what they should be eating and what they could be doing on their own. So that was really very motivating for me, to continue. So I started small with a few patients here and there, started seeing some really impressive results. That was sustainable, that they continued doing, and they felt great and they thanked me for it. And no one told them to do this before. Otherwise, they would have done it years ago. And so that was really very motivating. And so I started, and then of course it takes time. It's a lot easier to just prescribe a pill and a medication and electronically send it to your pharmacy than have a 15-20 minute chat about things that they could be doing. So I started noticing it was taking a lot of time. I mean, I definitely saw the value of it, but it was getting me behind. And I started thinking, what is the best way for me to share this information to more people and, in a more timely manner? Because I felt like I was going to start getting burnt out too if I was always like 20 minutes behind on everyone. So, that's when I started looking into the shared medical appointments, which just seemed like the most cost effective and the best way to share this information. We had never done it before. So it's completely new. And there was a little bit of a learning curve, trying to figure out like the dynamics of it. But we got it working. And I've been seeing like 12, sometimes 14 patients at a time. Our appointments are about 90 minutes. And I've been incorporating, like I have a physical therapy come in and we do some exercises. I have a mindfulness coach come in as well. And we do some guided meditations together. And then I also do a lot of the bulk of, the science and the knowledge behind the pillars. And we have group discussions, and every visit they get their biometrics measured, which is very motivating for them because they get their weight, their blood pressure. We also look at skeletal mass and visceral fat and things like that. And then we also have a questionnaire assessing their mental health, anxiety, depression, their motivation, and trying to see like how that has played in during the course of the 6 or 7 weeks of the program.
I love that. And that's a small enough group that I know they've shown group coaching, the way you're doing it is also beneficial because the participants rely on each other as well for support. And you want to talk more about that? You're shaking your head, so I'll let you take.
Yeah, absolutely. And that was, I thought, of course, like the education and the practical advice that we were going to be doing was going to be the biggest takeaway. And patients loved that. But when you're going through the kind of after action reports and the surveys afterwards, patients said that their favorite thing about it was the social aspect of it. So again, reminded me of how important social connections are. We live in a rural area. And as I mentioned, a lot of the patients were elderly, but they wouldn't have to be elderly. People are very lonely in this society. And it's hard to make new friends. It's hard to have connections. They looked forward to coming in every single week. They look forward to sharing how their week was and the changes that they made, hearing from other people who were struggling with the same things that they were struggling, whether it was a loss or trying to lose weight or whatever. Like everyone was kind of sharing their own struggles. People could relate and they felt supported. And that was one of their favorite parts. Was it wouldn't have been as effective if it was one-on-one. They loved the group aspect of it.
I love that. I need to join your program, except I'm not in Pennsylvania. Because we're all works in progress, even though I know the pillars, it takes time and energy and effort to practice all of them.
100%, 100%. It was motivating for me too, to see like people making the changes. It motivated me to continue doing it. So
Amazing. We're going to switch gears a little bit to the book. I know you've read a lot of the chapters and watched some of the interviews. Why do you think people should read this book? Doctors, healthcare professionals, non-doctors, patients?
I think it's such a powerful testimony of exactly what the title is, like how healers can heal. I just think it, for me, it was, whether a patient or a clinician, um, it really spoke to me about that I wasn't alone in my struggle. Sometimes, as being a physician, we feel we should have all the answers and be doing everything right. And for me, it felt great, like knowing that. And then you feel guilty that, you should be better, you should know better than, what you're doing. And for me, just also knowing that I wasn't alone and that other people were in the same boat, and how this could definitely happen, how we could sacrifice and our own sleep, our own nutrition, not exercise, and things like that. That it's a common theme amongst many people, and that we do have agency to make these changes. And there are things that we can do, the smallest little things that have its cumulative effect, and it's the small changes over time that really make big changes.
I agree. I mean, one of the reviewers on our Amazon review page says that, just to realize that doctors have challenges and struggles makes everything more real. So I think our openness and sharing our stories in this book is so, so powerful, like you said. Okay, amazing. I'm just looking at my questions. Two more. Just thank you for your time. But any takeaways for someone looking to make a change today? And then how to connect with you and anything else you want to add.
Sure. I think, as many people have mentioned, it's first believing that you can make a change. I think so many patients have come to me, with their whole family history of heart disease. That's a big one. Cancer, other things that they believe that it really doesn't matter what they do, because their father died at 55 of a heart attack. Their brother had their first ER visit for angina in their 40s. Like, it's just their grandfather died. It's just nothing is going to make a difference. And so, what's the point? I might as well enjoy what I enjoy and doing what I'm doing. And so, that takes that took a lot of a lot of discussions and trying to, in motivational interviewing and education, of actually getting people to the point of believing that they actually can make a change, and they're not going to necessarily have the same fate as their father or grandfather, and trying to have them believe that. And once they believe that they can make a change, it's worth trying, and they start making the changes, they see that they're feeling better, they see they're losing weight, they see that I'm decreasing their meds instead of increasing their meds. And that's the number one thing with anything. You first have to believe it.
That is so powerful. I love that. Um, wow. Okay, mindset shifts and belief in yourself. That's another quote. Okay, so how can we connect with you and anything else you want to share?
Absolutely. I would love to connect with anyone who's interested, in anything related to lifestyle medicine. I have my practice, which is stingmansmedical.com, but I'm also on LinkedIn. And just for this, I opened up an Instagram account just to connect to people on lifestyle medicine under my name, Dr. Lisa Pathak. So feel free to reach out.
I love it. More social connections and sharing your wonderful knowledge. Thank you so much for your time, Dr. Pathak.
Thank you, Dr. Pradhan, and thank you for starting this initiative. We're all so grateful.